Hello, friends. Dr. Trinh Lam Precision and
Dr. Lee from MD Anderson Cancer Center here in Saigon, Vietnam, here for vacation with Professor Long.
alright. Thì hôm nay chúng tôi sẽ nói một chút xíu về một cái trị liệu mà đang được tung hứng rất là hot gần đây, đó là cái truyền vitamin, hay còn gọi là IV drip, hay còn gọi là vitamin drips. Là một cái cách mà ta truyền vitamin pha vào nước biển và truyền vào cho chúng ta. Alright, so we talk a little bit about the IV drip, which is vitamin drips. That's currently on trendy right now. So, what's your opinion about the IV drip?
So my opinion on IV drips are really, I have seen an increase in the usage of IV drips in the young population. When I say young population, in their 20s and 30s, after usually a night of heavy activities of partying, and they would come in dehydrated, using a lot of alcohol, so they would get IV fluids and vitamins. And that's been a very common thing that we've been observing, especially in the scenes like Miami, Las Vegas, and now, even in Houston, Texas, we have seen clinics open up doing IV infusions of what they call IV vitamins and IV vitamin drips. Whether those are beneficial or not has never been FDA approved, and there have been no clinical trials to show that they are actually beneficial over just regular hydration like water or even pho. So I would definitely recommend, that you need to do some investigation into the research of IV drips. So far, the claims of the IV drip that these vitamins actually make you recover faster, unfortunately, there is no hard evidence to the benefit of these vitamin infusions. I do agree that the risk meaning, can you get harmed by it, is very low. But there is a risk there in terms of the manufacturing of these IV bags are unknown. These are not, quality controlled. So you have no idea who makes these IV bags. So I would be very careful to, receive any kind of IV drips from an unreliable source. Having said that, if you get vitamins and IV fluids, what we call normal saline, it is very minimally, toxic in terms of, as long as you have a normal kidney function and a liver function, I do not believe that you will have any harm. But is there any benefit? And that's the big question that we don't know. Oral hydration, I do agree, is probably the best outcome. What I call bang for your buck, drinking water or Gatorade or eating pho will replenish some of the electrolytes that you have lost. I do agree you could get a very high concentration of electrolytes through the veins, but that will have, unintentional consequences for patients with kidney issues or liver issues. So I would be very careful, without a true medical supervising this drip. And you would probably need a blood work even prior to getting these infusions. So having said all this, I do agree that, there's a lot of advertising for these IV drips, but buyer beware. Please be aware that these drips are not FDA approved and are not delivered usually by a physician. So I don't know what's going on. Professor Long, what is going on in Saigon? Is this something very commonly used?
Yes, I have to say that that's also very trendy here in Saigon, in Vietnam so far. And that has been advertised as a magic, magic infusion.
Magic infusion.
Magic, a drip that makes you like younger, like, makes you reborn. I mean, so for those kind of people, young people, they love it. And they pay for it with a pretty good price.
It's expensive. It's quite expensive.
The benefit is not very well proof by any clinical trial or any evidence, but they feel the patient who went for the drip, they feel that they
course.
get better after the payment, after the price. And also there's a lot of risks, like when you do the IV things, there are infection, you can transmit
Exactly.
some kind of disease that's unknown. And the deadly thing is the shock.
Yes.
So
Yes.
we are afraid of with a large amount of vitamins that unknown
Exactly.
origin
Exactly.
came to your body. It can be shock and gives a lot of the morbidity and mortality will be something that we have to taken care of. All right, so we not recommend for you guys having a drip. All right, the recommendation is only for a elderly patient who's in like a terminal ill, who couldn't eat, who couldn't